If you're just joining us, this is In Your Right Mind with Dr. Tonmoy Sharma and Dr. Cervantes.
So family is an important part. We were talking about the cultural differences of depression. I think in some cultures it is not okay for the man or the male to show any signs of sadness, whether it's a stoic society or it's just not accepted,
It's
not
a macho
expected.
society.
Yes.
I know my culture tends to be a bit more like that, where the man's supposed to have certain, tough masculine traits.
Right.
And of course that makes it very difficult because when a man is going through something, sometimes the depression comes across as anger instead of sadness.
Yes, and I remember when I was doing my residency, and I was doing it and culturally, there were people that would come and say, I have some pain in my chest, and they have been through everything, the cardiologist, the pulmonologist, and all of that, and then ultimately been referred. So, they sometimes in certain cultures they would exhibit physical symptoms.
Exactly, and that's very classic. Let's see if make sure I say this right. Somatization.
Right.
Is one of the things that I think is particularly common among cultures where experiencing something like depression or being pathologically depressed is looked down upon, not accepted. And so people...
Almost like a sign of weakness.
Exactly. Exactly. They pull themselves up from their bootstraps. And so as a result of that, they end up internalizing a lot of this emotion, and it can show up as chronic back pain, even things like knee pain or my neck, spasm, headaches.
My neck does have a spasm. It's a continuous spasm of looking down at phones and iPads and whatever else.
I mean, it can start with stress. Depression is a very sneaky thing. It can start with stress, feeling overwhelmed.
That's an important point. I wanted to belabor it a little bit.
Yeah.
What's the role of stress in depression?
I just had a patient, and I'm not going to even identify male or female, but a patient who is a very successful professional, whose parent recently passed away a year ago, and so this person has now had to manage duties that parent helped with, young children, and as well as their profession, and goes to bed at a reasonable time, around 10 o'clock at night, but gets up around 3 a.m. And so there is this sense of experiencing pressure, feeling overwhelmed, reaching burnout, doing all of these things because there is a love for the children and the profession and all of these things, but at the same time, there's little time for self-care. So if someone is any kind of busy professional, whether it's a physician or even a contractor or, then if there's very little time for self-care, then it's inevitable that stress is going to take hold.
So we need to take care of ourselves. Just when you were talking about somebody getting up at 3 o'clock, I think my brother gets up at like 4 a.m. Because he does yoga and he teaches all of that. So I think it's the amount of sleep, and rather than just when one gets up or whatever else, that's...
And is that even healthy to only get 4 hours of sleep?
Well, we'll do another show on sleep, and Dr. Cervantes has a lot to talk about it. I don't want to deflect her from depression, but very briefly.
But in fact, just to briefly answer your question, sleep is one of those things that if you do not get a minimum of 6 hours of sleep, not only are you much more likely to experience depression and anxiety, In fact, you can even experience some psychosis, some like hallucinations and things if you don't get enough sleep.
Sure.
But it can also contribute to chronic health conditions. And again, I don't want to go too far into it because we can talk about that some other time.
Right.
But it definitely impairs the immune system. That's how people get things like cancer, they get cardiovascular disease.
Also, as with decreased immunity, you're more prone to infections. You're more prone to all the other issues of decreasing immunity. You touched on sleep, so I used to teach residents, and so I go through this systematically sometimes. Biological symptoms of depression. That's
right.
So apart from mood, there are other symptoms that people should watch out for that are concomitant with the decrease in mood.
Sure. So one of the more common ones is a change in appetite. Usually it's a decrease in appetite. People will lose weight. On the other hand, there are those of us who, when we become depressed, we are emotional eaters. And, we will turn to especially sweet foods because we get that dopamine rush and that comfort food lives synthetically. It's what, it's not a great term to use, but like self-medicating,
Yes.
And people can use things like shopping, like food, like sex, like, even work. Somebody can be a workaholic and use that as an escape. But going back to the physical symptoms, so a change in appetite can be one of them, a change in sleep pattern. Sometimes people will experience difficulty falling asleep or difficulty staying asleep. And if it's a difficulty staying asleep, then you don't get good restorative, restful sleep, even if you're in bed for 8 to 9 hours. And then some people will be okay falling asleep and staying asleep, but then they'll wake up too early and then cannot go back to sleep. The other one is fatigue. So people will experience a feeling of lethargy, and that kind of goes along a little bit with the anhedonia we talked about earlier, is the pleasure, and so then the energy goes down, and they just don't have the energy to play with their kids, and it doesn't feel good anyway to go to the playground with their kids anymore when they used to laugh.
Right. So does sexual appetite, if you like, increase or decrease? You said somebody might be more hypersexual, so should I look for profiles that say they're sad? I'm not quite sure.
That is an interesting question. I would say that 90% of the time, and I know I'm pulling that out of the air, but I would say a great deal of the time, people lose their appetite for sex. Their libido decreases, and I think it goes along with the anhedonia because obviously sex is something that most people enjoy, and if you don't enjoy anything that brought you pleasure, well, that's one of them. So that's another physical symptom. And again, if your body is, experiencing somatic symptoms of your depression, then you might have aches and pains. You might even get like migraine headaches, things like that.
So in terms of the biological symptoms we've talked about the mental health symptoms. There's also, I find, an issue regarding stigma. If you break your arm, there's no hesitation of going to accident and emergency or casualty or going to urgent care, as we have it here in the U.S. But if your mind breaks, somehow you have to pull yourself up by your bootstraps, as you mentioned.
Yes.
Seeking help for mental health seems to be stigmatizing. I know that celebrities talking about their mental health issues has helped. People are finally realizing with COVID that mental health is a big issue, apart from the loss of brain function of some people who have suffered from COVID.
Exactly.
So let's talk a little bit about stigma and what it does across the board in mental health in terms of seeking help.
Sure. So, I remember I used to say to my Latino patients, because I'm bilingual. My first language was Spanish, and luckily I've been able to retain it. So I used to say to them, in our culture, having any kind of mental health issue is stigmatized. And we would have that discussion. But then I realized, as I spoke to my Asian friend colleagues and my African American friend colleagues, that it's actually very rampant. It's not just certain cultures.
In India, same thing.
So the problem with that is, if somebody is experiencing suicidal thoughts, one of the things that I've gotten in the habit of saying to my patients who do experience suicidal thoughts is, if you had chest pain, you would take yourself to the emergency room because you're probably having a heart attack, and you'd want to at least rule that out. Go get an EKG, have somebody look at it. If you're having suicidal thoughts, think of that as a brain attack. And I know that that's not a term that,
Well, it should be. I think it's a wonderful term as opposed to a heart attack.
Yes. And isn't it wonderful that you have the insight and the wherewithal to actually take yourself there? And so, and a lot of people who come with mental health concerns do have things and people to live for.
Right. So I guess it's mental health is important because the brain controls a large part of our entire body, so to speak. You fall in love not with your heart, but with your brain.
Yes.
So you are happy with your brain. So your gut feeling comes from your brain.
Right.
And not so much from your gut. So I think we're making these decisions, and we are experiencing a variety of things because we have because we feel a certain way.
Exactly.
This is In Your Right Mind with Dr. Tonmoy Sharma and Dr. Cervantes.